Welcome to Professor Russell Esposito's channel on information security. This video is just one of many video modules that are part of Professor Esposito's course on the subject. Video modules for his entire information security course are located on this channel. So remember to hit the like button as well as subscribe if you enjoy the video. Thank you for watching.
So clearly, the most significant healthcare regulation is the federal HIPAA regulation, HIPAA, which stands for Health Insurance Portability and Accountability Act. It was passed in 1996, not enforced until 2003. But what HIPAA provided was three things. Insurance portability, which meant if you had pre-existing conditions and you changed jobs, the new company with the new insurance company would have to cover you. So if you had insurance company X, you quit, you went to a different company, and you got insurance company Y, they would have to cover all of your pre-existing conditions. So that was a good thing. It also provided privacy and security regulations. Security meaning the technologies, the safeguards to protect the information, and privacy meaning giving the patient the ability to control who gets the information. So we'll talk about that a little bit later, the difference between privacy and security. And the third thing that HIPAA provided was administrative simplification, and that's standardizing the electronic data interchange, the EDI, electronic data interchange. Those transactions were not standardized throughout the industry. So it did three things that were good: insurance portability, health information security, privacy and security regulations, and administrative simplification. And HIPAA covers what's the entities that have to adhere to HIPAA are what's called covered entities. And these are healthcare providers, doctors, hospitals, health plans, which, HMOs, health insurance companies, and clearinghouses. Clearinghouses are these technology go-betweens. It's a link between the providers and insurance companies. It doesn't create bills, the clearinghouses, it just transmits them to the many different insurance companies, because a provider, a hospital, or a doctor could have 100 or 200 different insurance companies. The clearinghouse sorts the claims out at the end of the day, sends them to the right insurance company. It does some other editing and sort of cleaning up of the checking of the bills as well. But essentially, it's a mechanism to transmit the claims or the hospital bills, the doctor's bills to the proper insurance company. So now, when this bill passed, the only covered entities were healthcare providers, healthcare plans, insurance companies, and clearinghouses. All consultants that are looking at patient data, downloading it, using it, massaging it, whether they're programmers in IT, finance, or HR, human resources, etc. All of those consultants in the business, in the healthcare industry, are called business associates. They are not covered by HIPAA. So even though they had access to patient data, they could do whatever they wanted to do with that data, and they were not covered by HIPAA. The patient's privacy and these of the healthcare information was not secured by the HIPAA regulations. This was addressed in 2013, quite a bit later after the HIPAA legislation was passed. In 2009, the HighTech Act was implemented, and this really added some additional features to HIPAA. First of all, on the good side, it added economic stimulus. It was part of the American Recovery and Reinvestment Act to stimulate the economy after 2008 financial crisis. So this economic stimulus legislation provided money, financial incentives for providers and hospitals to buy electronic medical records, really focusing on the physician practices that did not have electronic medical records. Hospitals have had EMRs for many years. So there was stimulus for that. And then at some point, if you were reimbursed for your implementation of your EMR, if you could prove meaningful use. So that's the second bullet here. You had to show that you were really using the system, and there's a whole set of criteria just for that. And then at some point, this became no longer a plan for incenting providers to get electronic medical records if you did not implement a medical record
electronic medical record, you were penalized. Your Medicare, Medicaid reimbursement would be reduced. So it started out as economic stimulus, giving money to providers to buy EMRs, assuming they passed meaningful use criteria, that they showed that they were actually using the system. And then it evolved into, you have to do this or you'll be penalized. And the other thing it added was breach notification rules. HIPAA never had breach notification rules. So if a patient's medical records were improperly used or shared, or there was a breach, there was no the legislation did not require notification of the patient. This HighTech Act requires that notification, and of course requires notification to HHS, Health and Human Services, and it also provides gives the Office of Civil Rights greater ability to enforce all of the HIPAA rules and to levy fines, which can and have gone into the millions of dollars for some organizations that have had serious breaches of the HIPAA regulations.
And so the healthcare regulatory environment matures a bit further in 2013 with the Omnibus Rule. So we mentioned earlier that HIPAA covered the covered entities, right? Providers, health insurance companies, and clearinghouses. But there are lots of consultants that work for healthcare companies, for hospitals and providers. They're IT. They could be IT folks, programmers, network people, HR consultants, billing consultants to help, sort of optimize the billing procedure and the amount that they're paid. They would sign these business associate agreements mentioned in the first bullet here. So if you're a consultant, you're called a business associate, not covered by HIPAA, but you'd sign the business associate agreement that said you would follow the HIPAA regulations. But it was unclear if the consultant, the business associate, did not follow those rules, who's responsible? Who gets the penalty from the federal government? The consultant or the hospital that hired the consultant? So this cleared it up. The Omnibus Rule basically said the business associate, the consultants, are responsible independently, and they would be the ones subject to a fine or some negative incentive, let's say, from the federal government should they break the HIPAA regulation. So it cleared that up. Consultants are not covered entities. They do not have to follow the HIPAA regulations. They're called business associates. They sign business associate agreements called BAAs in the first bullet in the slide. And now it's clear when they sign that, they are responsible. If they break the HIPAA regulations, if they have a breach or they lose patient data or somehow, they're responsible. They're penalized, not the hospital or the provider that hired them. Okay, so that's what the Omnibus, that's the basic thrust of the Omnibus Rule, was to clarify that. So this is sort of an optional information slide. I don't expect you to study these various transactions, but just to give you a little deeper understanding, the third piece of the HIPAA regulations, that was the administrative simplification, that standardized transactions. These are the kinds of transactions that are standardized with electronic processes, and they have numbers like you can see in this 270, 271, that's insurance eligibility. The provider sends a 270, it asks, is this patient covered? They send the transaction to the insurance company electronically. Their insurance company answers with a 271, the very first block here in these two columns that you're looking at. They send a response back at 271 that says the person's covered or not covered, some details about eligibility. So as you can see, there's a number of different things. In the middle of the page here, you see claims 837. They're all standardized. I'm not expecting you to know these. This is just sort of additional information. You're not going to be tested on this level of granularity in terms of administrative simplification. But you should know that HIPAA does have a component of administrative simplification, even if you don't know these transactions, what they are and what they do exactly. They're just here for your additional edification for those who may be a little more curious about how this works. So HIPAA also requires a risk assessment, risk analysis and assessment. And essentially what that is there's this term PHI, patient health information or personal health information. And it could be paper, it could be electronic. You'll see in the top center of this circle, you see a term EPHI, electronic PHI. But hospitals and providers need to do a full risk assessment of paper and electronic personal health information. They have to have an understanding of which systems they have what kind of personal information, understand the vulnerabilities, what these applications or these networks are, how are things stored, what's the risk, and determine about the level of the risk. Is it high or low risk? And then mitigate it as best you can, understand what the controls are. You can't eliminate all risks, but you can certainly mitigate it. You need to show how you're mitigating it. So for example, data stored in a database, it's not encrypted. That's a higher risk. You want to encrypt the data in the database. Emails may have PHI, personal health information. You need to encrypt that email. So you need to do the things you can without understanding that not all risks can be completely eliminated, but you need to understand what your systems are that have PHI, understand what the vulnerabilities might be, what the risk may be, how to control that, and put together a plan that's reviewed annually to ensure that as things change in the company, new systems are added, processes change, that you're continually updating your risk assessment and your mitigation policies. And this is not unique to HIPAA or healthcare. Risk assessments are done in every industry. It's just that HIPAA requires it, and that this is something that hospitals and health care providers need to address and document.
All right, let's talk about what should occur if a PHI breach should occur. First, if there's any sort of information incident that has the possibility of being a PHI breach, the parties who are aware of the incident should consult with the legal department or the company's general counsel immediately. They're really the ones that can best evaluate how serious this may be to the regulators, and a conversation with legal is highly advisable. If there is a breach that includes 500 or more patients, then a few things need to occur. The individual patients affected need to be informed, as well as the U.S. Department of Health and Human Services, and typically an ad will be placed in newspapers describing the breach so that a public notice in the appropriate geographic areas occurs. A breach is something that can also create public relations problems since the company is seen as a company in which there are not sufficient safeguards, and your company's competitors would love to use a breach as a way to steal customers away from a company that's had the breach. So it's a PR, it's a public relations problem as much as it is a regulatory problem.
There are 3 other federal regulations that you really should be aware of. Actually, 2 of these are regulations or legislatively required, and 1 is a standard. So let's first look at Sarbanes-Oxley, sometimes called SOX, S-O-X, the Sarbanes-Oxley Act. And essentially what this was it was a response to some sort of scandals and fraud in terms of the public reporting that companies were promulgating. And this could be a problem for the stock market. As people are buying stock, they're generally buying stock based on various public reports that publicly traded companies that have public stocks have to provide. So what Sarbanes-Oxley does is have a set of audits that are required within a company to sort of track the data as it flows from system to system and as it gets reported, so you have a higher confidence that the data is accurate. So Sarbanes-Oxley, the SOX Act, covers publicly traded corporations, companies that have public stock offerings, to try to ensure that the financial statements are accurate. And it does this by looking at audits, that there should be audits happening during the year to ensure that certain standards are met and processes are met, standardized, so that you're not having problems. It could be, and it's another conversation to go through the details of Sarbanes-Oxley, but generally they're quarterly reports internal to the company, and an annual report that their public accounting firm, a public third party, would come and do an audit as well at the end of the year. But what's interesting about Sarbanes-Oxley, they're very good standards. Sometimes large companies, even healthcare organizations like a nonprofit health system or hospital, might employs Sarbanes-Oxley internal audits to ensure that their standards also are as high as they can possibly be. So Sarbanes-Oxley is required for publicly traded companies, but sometimes companies that are privately held or nonprofits will still follow Sarbanes-Oxley requirements for audits to ensure that their financial reports are accurate. And then let's look at Gramm-Leach-Bliley Act. That's essentially an act that was passed to ensure privacy regarding your personal identifiable information that banks and insurance companies or any financial or fiduciary organization that you have they're maintaining your funds. They have to follow certain requirements for privacy and security so that your personal information about your finances is not exposed. And then finally, the third piece on this slide is not legislation, it's not required, but it's a payment card industry standard. So PCI is payment card industry standard. It has certain requirements, some procedural, some technological, in terms of ensuring security and privacy regarding your credit card. So these are the three other sort of standards. Two of these are actual legislations, federal requirements, and the third is of course HIPAA and the other sort of less known items like HighTech and the Omnibus Rule. And that concludes this presentation essentially.
Sarbanes-Oxley regulations have been undertaken successfully by many private organizations, including hospitals and nonprofits. Now, these organizations are not publicly traded and not required to follow these Sarbanes-Oxley regulations. But since many of the SOX or Sarbanes-Oxley practices support HIPAA rules, many organizations that are not required to follow Sarbanes-Oxley have done so. And if you look at some of the things that Sarbanes-Oxley requires, you can see how they lend themselves to enhancing a security profile for an organization, such as a quarterly review of IT processes and controls, encryption where it makes sense, particularly for PHI information, ensuring printers and faxes aren't left with unintended documents carrying PHI, employee education about privacy and security, how documents are destroyed, how PCs and laptops are destroyed, how PHI information is destroyed once a document or a device is no longer needed, and a whistleblower hotline so that someone who sees something wrong, whether it's intentional or unintentional, can call someone privately and leave a message with a compliance officer. They may not want to talk to their employer or to their supervisor. The supervisor may be part of the problem, and they feel comfortable addressing it with them. There should be a code of ethics that's conveyed to all employees. There should be an audit committee that's looking at what's going on in terms of policies, procedures, and what's happening with controls, with the financial controls or IT controls. And the CEO and the CFO certifies financial statements so that we have attestation by a senior officer in the company that these are valid statements regarding the company's finances.